How to Clean Dentures, a video for patients. You should clean your denture at least once a day to remove food and plaque. Plaque is a slightly clear or whitish film made up of bacteria that use food to attach to your denture. It can cause buildup of tartar and stain on your denture, and it can cause your gums to become swollen and redden. This can result in a less secure fit of your denture. Because plaque is like a film of glue, it must be mechanically removed by a brush. It cannot be rinsed off by water, a salt rinse, a mouthwash, or even a dental irrigating machine. Best evidence suggests using a combination of brushing your denture, then soaking it overnight in an antimicrobial solution. Because plaque is transparent or whitish when damp, it is difficult to see, so you will need to be thorough and systematic when you brush to make sure you remove all of it. If you miss removing some of the plaque, calcium in your saliva can deposit on it, hardening to form calculus or tartar on the denture. Like plaque, tartar can almost be invisible on a denture when it is wet, so you may not be aware that you have the problem. Tartar cannot be removed with a brush, and unfortunately it forms a rough surface, which makes further buildup easier. Your dentist can clean off tartar or calculus from your denture for you. Prior to brushing your denture, fill your sink with water, or place a face cloth over the basin so the denture will not break should you accidentally drop it. Rinse your denture, then use either a regular soft bristled toothbrush and or a long bristled denture brush if it makes it easier to get into all the nooks and crannies of your denture. There are several different shapes and models. Find one that works well for your denture. You can use more than one if you wish. Avoid hard bristle brushes that will increase wear on the denture. Use a liquid dish detergent, not dishwasher soap, or a mouth rinse or a denture toothpaste for brushing. Dampen your brush before using it to minimize scratching of the denture. In general, avoid regular toothpaste or baking soda, as they have abrasives that may wear your denture faster than normal. Whitening toothpaste will not whiten denture teeth. Scrubbing firmly or using a hard bristled brush is not necessary and won't clean your denture any better. It is more important to ensure that you brush over the entire outer and inner surfaces using a vibration to dislodge or remove all of the plaque. Try not to brush haphazardly so you don't miss any areas. Instead, develop an order of brushing that makes sure you cover all areas. For most people, it will take about 1 minute per denture to ensure proper cleaning. Hold your toothbrush with your whole hand, like this. Don't hold it at the end or with a few fingers. For most people, this will give you the most control. When brushing your lower denture, hold one side at a time rather than gripping the whole thing as you brush so you don't end up accidentally squeezing and breaking it in your hand. Use a wiggling motion or vibration to try to dislodge plaque from the denture in crevices or hard-to-reach areas. Use brushing strokes over broad, smooth areas of the denture. Remember that cleaning the inside of the denture is just as important as cleaning the teeth, because the inner surface affects the health of your gums and the fit you enjoy. Try to brush really well at least once a day prior to soaking at night. Brushing after meals is helpful, but in many instances this may not be possible. Rinse your dentures after meals if brushing is not possible. It is preferable to clean the denture thoroughly at least once a day than to brush poorly many times and continually miss areas on your denture. Wearing your dentures all day and all night is like going to bed with your shoes on, so remove your dentures overnight to allow your gums to have a rest. Prior to bed, use a dampened soft bristled toothbrush or a dampened face cloth to massage your gums for best tissue health and denture fit. Overnight, soak your dentures in a liquid cleanser to keep them moist so they don't warp. For most patients, it is easiest and most effective to use a commercial cleaner in your denture cup. Follow the manufacturer's instructions. Occasionally, dentures can be soaked in diluted vinegar, 1 part vinegar to 9 parts water, to help dissolve tartar buildup. Dentures can also be soaked in diluted bleach, 1 part bleach to 10 parts water, for no longer than 10 minutes for disinfection and stain removal. Never use full-strength bleach on your denture or soak it in dilute bleach longer than 10 minutes, as bleach can discolor, roughen the surface, and reduce the strength of your denture. Always thoroughly rinse dentures after soaking prior to placing them in your mouth. Bleach and other cleansers can cause irritation to your gums and should not be consumed. If you have a denture with a soft liner, or if you have a partial denture with metal components, do not use bleach or normal commercial cleansers. The bleach in these products can damage the liners or corrode the metal. Instead, use a commercial cleaner specifically designed for these dentures and follow your dentist's special cleaning instructions.